API is a forum to facilitate and enable Indian American physicians to excel in patient care, teaching and research, and to pursue their aspirations in professional and community affairs. API USA has been engaged in harnessing the power of Indian diaspora from all over the world to bring the most innovative, efficient, cost-effective healthcare solutions to India. Since 2007, with the launch of the first Indo-US Healthcare Summit in Delhi, under the leadership of Dr. Hemant Patel, the former President API, and Mr. Anwar Feroz Siddiqui, the Honorary Advisor. Since then, API has made significant progress, and under the leadership of Dr. Jayesh Shah, President API, has seen major transformation into a global healthcare summit, which was held from 2nd January to 5th January 2014 at Ahmedabad Management Association. API would like to make a positive, meaningful impact on healthcare in India. The mission of API is to share best practice and experience from leading experts in the world and develop actionable plans for launching demonstration projects that enable access to affordable and quality healthcare for all people. To accomplish this mission, API is backed by leading healthcare experts and professional associations, including Ministry of Overseas Indian Affairs and Indian Development Foundation, and Ministry of Health and Family Welfare. API has organized 7 Indo-US Global Healthcare Summits and developed strategic alliances with various organizations. It is these learnings and relationships that have now enabled them to plan ahead and prepare for outstanding events that has already received confirmation and endorsement from over 300 very prominent and talented physicians and surgeons that are very passionate about serving their homeland, Mother India. In addition, several international healthcare industry partners are looking for opportunities to participate in these events for greater collaboration on research and development and philanthropic engagement.
Well, the last 2 days what you witnessed was a grand success of a global summit. This had a very large attendance of international delegates. More than 350 delegates came from United States, Canada, UK, and they had a wonderful experience because this conference got them something which they never witnessed before. They had some skills workshops, they had advanced cardiac life support, the GI endoscopy workshops, they had wound care workshops, they had head and neck cancer workshops. So there were many things that were there which were different than what they were used to in other conferences. What we were able to impact as a group, as a API, where we were able to initiate a portal which is called a Swasth India portal, which is going to be launched today by our Health Minister, Sri Gulab Nabi Azad. And that portal will allow the API members to connect with the volunteer opportunities in India with NGOs or with government or with the educational institute while they are coming here for vacations or just to serve their motherland. They can connect and they can select where they want to volunteer. So our theme was very simple. It was accessible, quality and affordable healthcare to every citizen of world, kind of globally.
I'm not a physician, but I do utilize my expertise, my skills, and my ability to bring together people from different areas towards a common cause. And I can see that it's tough. It's very difficult to have the Director General of Health Services, the Minister of Health, and the Minister of Overseas Indian Affairs on one platform discussing with people from industry, with people from medical institutions, with government colleges and universities towards a common cause. And I see that it is gaining momentum, and it gives me personal joy because it's all patient-centric. We are making a difference for the average person in this country.
It's our pleasure to be here and a great honor to participate in this meeting. We were invited by API, and the relationship between the American Heart Association and API has been growing stronger and stronger as we work together to transfer information from the U.S. to India and back from India to the U.S. We found that there's a great synergy between the two organizations, learnings that we take from each country that improve care in both places.
And do you have any programs as a part of the API doing in the United States now? You will be continuing the same partnership in the U.S.?
Yes, much of our work so far is focused on resuscitation, which is advanced life support and CPR techniques and training. We're beginning to expand that focus, though, to advocacy around programs in schools for health and CPR, and are discussing plans for shared scientific collaborations, joint sessions at our meetings both in the U.S. and here in India.
API is the American Association of Physicians of Indian Origin. These are all people who have gone from here and have settled abroad, mainly in America they have settled. And they come over. At present we have a very cordial relationship, but that relationship is limited to only, unfortunately, they once in a year, once they come over here, then they have a meeting and then they go back. It is an exchange of knowledge there. Sometimes they invite us to America whenever their convention is there, and then we go over there. That association is limited at present to that extent only. In America, there is more of technological advancement is there. In India, more of clinical material is there. How to amalgamate these two things can make a lot of difference in the life of people. So, clinical experience, people can come over here from USA to here, and people from India can go for more technological advancement there. So this kind of arrangement is required. Second is regarding some kind of fellowship to be started where people from here, like hospital infection control, which are more advanced there in terms of some fellowship in some critical areas like in emergency medicine or in oncology. And there we are looking for that some kind of relationship should develop where Indian doctors can go over there. And thirdly, there should be for the student also some exchange program, their student coming to India and from here people going to that place and learning few things there. So that is the goal. I think it will take some time, but we are hopeful that we will be able to achieve this goal.
You know, surprisingly, we are so emotionally attached to salt. We actually have a love affair with salt. But it is not an addiction like smoking. It is very hard to quit smoking. On the other hand, cutting back salt in your diet is a very easy process. For most people, it could take as little as a weekend, like 10-12 meals. So I've written about it based on actual real-life experiences in my blogs. I write a blog almost once a week at the site called saltkills.com. You might check it out. So this is not an addiction again. Once you understand how many different ways your simple salt habit hurts you, limits you, and causes disability and death. Once you understand these facts, then you will retrace your habit to a point that you'll cut back on your salt intake and easy to overcome. You will easily reach a point like I and many others have done, that in the salt addition to the diet, your food actually makes the taste worse instead of making taste better, as the conventional wisdom might make you believe. So one day you'll suddenly say, if somebody gives you something salty, you don't like it just for the taste of it. And the benefits you will get from this are not only from cardiovascular disease. There are other major problems like osteoporosis, for example, which affects almost all postmenopausal women, And salt has a lot to do with it. People keep on taking various calcium supplements and everything to prevent osteoporosis. But unfortunately, osteoporosis is a disease of calcium loss. You lose calcium because the kidney is trying to get rid of the excess salt you add to your food. In that process, it loses calcium. That's how you get osteoporosis. Unless you stop the intake of salt, you will not be able to overcome the osteoporosis. For example, that's one big benefit from reduction of salt intake.
The organization is called BAPIO, which is British Association of Physicians of Indian origin. There are 50,000 Indian doctors working in England. The National Health Service of England, called NHS, is really dependent highly on Indian doctors. Indian doctors are known as backbone of National Health Service. Now, with this contribution of Indian doctors to National Health Service, there are also some issues. Issues like passing the examination, issues like promotion and so on. There is slight discrimination in the country, and as an organization we are working hard to get over it. The recent episode has been about Royal College of General Practitioners, where the pass rate for Indian doctors is much lower than local English graduates. So we have been in dialogue with the college for a long time, but when they were not budging, we have taken to the court for judicial review. So that's a big thing happening now. However, as an organization, we are doing a lot of work for Indian doctors. We have lots of conferences, we have road shows, we have workshops. The idea is to assist them in achieving professional excellence. We have some very high-profile doctors as well, and they are getting more and more coming up the ladder now.
I heard you talking the other day that one of the Indian doctors delivered the baby of the... so would you like to comment about the doctor?
Well, the grandson of the Queen is Prince William. His wife delivered recently, and the delivery was conducted by one of the Indian doctors. So that was very nice. It was absolutely incredible. Yeah.
Every Indian is ambassador for India in USA. Most of us have settled there for more than 35 years. And what I would strongly suggest to all of our counterpart physicians in India is to help their own community. Like Mr. Narendra Modi yesterday said, that India is full of talent, Gujarat is full of talent. We have an institute called iCreate, and we must create the application which are affordable, accessible, and available all across the globe. Healthcare access is a major global issue, and I think what we Indians have a talent is to develop the tele-video and telemedicine care, which what we have started in USA is new initiative called telemedicine, telehealth, and televideo. We can examine the patient remotely with pretty much accuracy in the rural area where we don't have access of physicians and the paramedical people. Now this initiative can be done so well in Gujarat, because what I was impressed with 108, they have access everywhere. And with our new initiative on telemedicine, I do believe we can create better environment for every Gujarat resident and Indian resident to get a great health care across the globe and across every district. I think it's a very good initiative, and hopefully API and the Gujarat government can integrate some of those new technologies which are available in USA to make it household name. And it's economical, available, and affordable. So let's go improve the status of India, improve the healthcare of India, and API is instrumental in taking the message to all of us and unite every Indian doctor across the globe. As you know, 1 out of 7 doctors in the world is Indian.
This particular Global Health Summit has come up and gone beyond our expectations. We have been doing this for almost 8 years, and it has grown each time, and I'm glad to see that it has grown even further. Many unique things were offered here. We had the workshop, which is for skills, and the skills have gone very well. This is for training young doctors and residents and students. We also had what is called a CEO Forum and the first Global Leadership Council. As you realize, it is API, which is the American Association of Physicians of India. but we do take a global role because people want to join in to give back to their motherland. We see this at all places, and as far as the lectures which are there, it is more of an interaction. It's not that we come here to teach. In fact, we learn much more than what we give here, so we are grateful for that. And last of all is we also are quite familiar with the policy makers at the central and state level, and I'm happy to tell you that they are very, very cooperative, they're very understanding, they take our advice on many matters, and again, we appreciate that.
I practice many areas of law, but the main passion is this EB-5 visa, which has become very popular in China, Korea, and also it is now coming up in India also. This is a visa where you can obtain permanent resident status in United States within approximately 1 year, 12 to 15 months. For the family, husband, wife, and children. There are no educational qualifications required, and no business experience requirement. It's strictly based on investment. Investment varies from $500,000 to $1 million, depending upon if it's a targeted employment area or it's an ordinary area. There are several requirements. Source of funds is a main criteria. We have to document how the funds were accumulated for this investment. Gifts from foreign relatives, doctors, doctor friends, relatives can be used for this investment. Anyway, this is a very good program, and I would recommend that it's worth taking a look at it. If you have any family member who you would like to bring to US in a relatively short period of time. And thank you very much.
Basically, we are a healthcare knowledge process outsourcing company. We are into medical transcription, clinical document management services, and revenue cycle management and software development services. So basically, our organization helps all the physicians based in US to achieve the meaningful use along with the best of the best technologies. We help them leverage the platform that we have, and we leverage best of the best processes and technology in order to help all the physicians reduce their efforts, increase their productivity, and achieve the meaningful use and gain the incentives which is declared by Obama government.
Our convention in San Antonio is a 32nd API convention.
Their efforts.
The first one was in Dallas, that was the 16th one, and 23rd convention was in Houston, and now we have third time in Texas in 2014. The highlights of this convention, beyond the usual activities, that we want interaction not only among the physicians but also with different areas such as organized medicine as well as entrepreneurs, those who are closely involved with API in one form or the other. It's a 5-day event. We have in fact devised our exhibit hall very differently than normally we do to accommodate many vendors. We also hope that we shall attract the sponsorships in the past as we have always, and I think it is going to be a great event for the doctors, their families, as well as our friends to come together and celebrate their convention along with Dr. Jay Shah as the president.
Well, I practice cardiovascular medicine in the United States, but I see that India is under a alarming threat of a twin epidemic, diabetes and heart disease. And that really touched my heart. And for the last 25 years, I'm coming here on my own, trying to find out, connect with the people to fight this growing menace of cardiovascular disease. There's a myth out there that cardiovascular disease is more common in Western countries, but actually is much more common in middle and lower income countries like India. And because of the poor resources, poor infrastructure, poor access, and poor affordability, people are dying in millions right and left. And there's a growing awareness lately now, but for 20 years nothing was happening. Now I'm very glad to be part of it, and I'm working on NGO and on government organizations to raise the awareness, to write the guidelines, to work myself as a volunteer, and to work with the API and Agapio and some other organizations to fight this menace.
Dr. Sharma, being a cardiologist, what kind of an advice you have for a common person living in India to take care of their health so they have a healthy, long life regarding the to their heart?
The cardiovascular disease is rampant all over the world, but the best intervention is prevention. And for an Indian or South Asian who is at a high risk for cardiovascular disease, the best thing is changing a lifestyle. And 4 or 5 things are basic. Exercise every day, watch your diet, and lose weight, and then meditate, because there's so much stress. These 4 or 5 things, and then go for a checkup. And if you are at a high risk, please take aspirin, statin, whatever needs to be done, and check out for a diabetes, which hits early young people very early. These 4 or 5 things will go a long way in reducing the burden of heart disease by 60 to 70%.
We started the API charitable clinics in 1989, and we gradually got about 17 clinics that we run in the country. And these are also mostly in the rural places, and these serve the underserved people in India, the poor and the underserved people. So from the 17 clinics, we had to stop 3 clinics because they were causing problems with accountability and transparency. But we did add 1 more clinic in Cochin. So right now we have 15 clinics that we run in India. We started the Cochin clinic last year. So with our outreach programs, we serve annually about 1 million patients a year through the clinics. And these are mostly in the slum areas, in the underserved population. Most of our clinics are small clinics, but they serve a lot of people because they do rural health camps also. At least many of them do quarterly health camps and go to outreach places. Besides that, some of the clinics have evolved into multi-specialty clinics and also have evolved into small hospitals. For example, there is a clinic in Kartarpur which started as a small clinic, and the local people and the alumni of the Amritsar Medical College, they also added to our funds, and they have now a dialysis unit. They also have a laparoscopy unit. They do high-risk pregnancies also, and so they have evolved into a small hospital. So like that, we have many clinics. They are also on a highway, so now they're looking for a CAT scan, and they have approached us to see if we can get a CAT scan because they have a lot of head trauma.